Healthcare is changing, and Dr. Nancy RN is here for you. The topics are many, but each program stands on its own with 3 key action points for you to learn. Your guide to a healthier you in a changing world. Dr. Nancy RN.
Welcome to Dr. Nancy RN, Healthy You, Healthy Nation, Healthy World. I'm Nancy Valentine, PhD and registered nurse, and this show is dedicated to you, the healthcare consumer. And today we have a fascinating show by 2 sparkling returning guests. And the title of our show is The Face of Cancer, Before and After. And we had both of our guests in previous shows. I will first introduce Dr. David Lowe from the Hospital of the University of Pennsylvania and give you some background on his wonderful career. He is Professor of Surgery, Division of Plastic Surgery from the Perelman School of Medicine at the University of Pennsylvania, and practices as the attending surgeon both at the Hospital of the University of Pennsylvania and at Children's Hospital, and he's been there since 1989. He is a graduate of Harvard College Harvard College and Harvard Medical School. And he spoke in a previous show about the world of plastic surgery and the kind of work that he does, which focuses a lot on reconstructive surgery. And that's what we'll be focusing on today, using as one of his more successful but nonetheless extremely complicated case that entailed Clark Natale. And you may remember meeting Clark and his lovely wife Anita, because they did 3 shows for Dr. Nancy and for you, really to educate you, the consumer, about their amazing journey with more than 5 years invested in really coming through what started out to be a very relatively minor case of a loose tooth that turned into a diagnosis of squamous cell carcinoma of the mouth. And Clark is a hero, as is his wife Anita. And they talked about their personal journey as a couple. Clark did a separate segment on his journey as an individual with all the impact that this had on he as a person. And Anita did a show on her own experience as the primary caretaker. So if you haven't seen those shows yet, you can access them through both our website and YouTube. And Dr. Lowe's past program on plastic surgery will help to inform us, because what we've learned and what we're going to be talking about today is the artistry of plastic surgery. Dr. Lowe thought he wanted to become an architect when he was younger, and then he took a left-hand turn and used those very early interests and his skills and his artistry to become a renowned plastic surgeon. And Clark had a wonderful career, very successful businessman, a gorgeous wife, everything going for him, and he had a loose tooth. And when he went to have his loose tooth checked, that's when he found out that he had this really devastating diagnosis. But what I'd like to really start with today, and I want to both welcome you back and say how pleased we are to have both of you. Really, it's an honor and a pleasure. Thank you.
Well, it's very nice to be here.
Thank you, Nancy.
Well, what I'd like you to do is really tell us about your journey and how you met Dr. Lowe, and to the best of your recollection, because I'm sure there was so much going on that it's really hard to remember a lot of the details. And then we're going to ask Dr. Lowe to talk about some of the specifics of how his work really started with you and what were some of the lessons learned along this very long and complicated journey.
Well, once the diagnosis came about, we went to the University of Pennsylvania and met with Dr. Weinstein. Prior to the surgery, we went and saw Dr. Lowe to show him, or he pointed out what his role was during the surgery. And he explained to us that they were going to take the cancer out and take the tissue out, and then they would have to replace the tissue using the tissue from my thigh. And, you know, it was explained to us very directly, and, you know, that was the end of our communication with Dr. Lowe at that point. And then we went through this. I went through the surgery, and Dr. Lowell did his part of the surgery, and I was in the hospital about a week, and I went home. And when I went home, things were not right. So we called Dr. Weinstein, and he insisted that we come back to the hospital. He thought, after we described what my problem was, that I might have an infection. Well, we got back to the hospital, and he told us that the tissue that was in my mouth was infected, and they had to take that tissue out. And then they would have to resurgically apply new tissue. And having said that, I was in the hospital a good 10 days to make sure this surgical tissue was not infected. And it wasn't. So I went home, and after I got home is when my wife basically took over my care, which she did, and really got me through this. Now, during that surgical procedure, they inserted a brace to hold my jaw together, because part of the surgery required taking part of my jawbone out, because the cancer got into my jawbone. And so I guess that was maybe two surgeries at that point. As time went on, I noticed this plate sort of now coming out of my skin, and I couldn't figure what that was. So we went back to Dr. Weinstein, and he then referred me to Dr. Lowell. And at that point, the plan was, well, let me back up a minute. They discovered that where they had to get the cancer out of my jaw, that the jawbone was fractured. So after meeting with Dr. Lowe, the plan was that they were going to take this brace out, and they would have to rebuild my jaw by taking bone out of my fibula, was it?
Fibula, right.
Fibula. And so that was the plan. So I had surgery, and that was probably almost 2 years after the original surgery.
That's correct.
Does that sound right? Yeah. So now I'm 2 years into this. But at that point, the good news is I had no cancer or reoccurring cancer. Mm-hmm. So I felt pretty good.
Well, let's stop with that and just, again, walk through each one of those experiences. First of all, in this program, we're showing some pictures of what Clark looked like before he even had a diagnosis of cancer. And one of the things that we mentioned in our previous shows is that Clark really had no symptoms. He had no pain, he had no swelling, he had a loose tooth. He had been to the dentist a year prior, so he was going back for his yearly checkup, plus he wanted to have this loose tooth attended to. And what was found is that he had cancer, but he also had an advanced enough case of cancer that Dr. Weinstein, that you're referring to, really had to go in and really excavate, really take out a large part of his face and the bone. And I think that's where I'm going to turn over the expertise to Dr. Lowe, who can really describe, how you all work together as a team with someone that came and presented with this kind of problem?
Yes, Dr. Gregory Weinstein is really our senior head and neck cancer specialist. And so he removes many, many types of oral cancers. And in this case, he realized he would have to take not just part of the gum tissue, but also part of the jawbone itself and part of his inner cheek soft tissue. Now, when you have a defect like that, you really cannot eat after that. And it's really something that a simple skin graft, something very thin, is not going to be healthy enough to sustain the healing and also to sustain the radiation that one would anticipate needing after surgery. And so in this case, we often collaborate with our head and neck surgeons, and we harvest tissue from somewhere else in the body. Now, most commonly, it used to be from the forearm because that tissue is nice and soft and pliable, and that would require taking one of your arm arteries and a vein and then bringing all that tissue up to the head and neck region, sewing it into the defect, and then you would have to reconnect both the artery and the vein to an artery and vein in the head and neck region. That's a technique known as microsurgery.
Right, that sounds extremely complicated
It's
and very delicate.
Yes, in fact, the sutures that we use are finer than human hair, and so we use either very strong magnifying glasses or we use an actual operating microscope to magnify these tissues. Now, in Clark's case, because he was a nice, slender person, we were able to instead use his thigh tissues, which is a piece of thigh skin and the fat and blood vessels that go to that patch of skin. The donor side is much more forgiving because it's simply an incision on your thigh as opposed to a skin graft on your forearm. And
Less
yes.
visible after surgery.
Correct. If you're going to wear shorts or bathing suit, then someone is going to see that defect, but it is just a line scar. Now, the nice thing about collaborating is while Dr. Weinstein is taking out the cancer, we are already down on his leg harvesting that tissue. So the operation goes much more efficiently because we're working in parallel, not just one after the other. Now, the problem with microsurgery is that the success of your operation really depends upon both the artery and the vein staying open. And in over 95% of the time, that actually works. But all operations carry risk, and all operations can have complications, and unfortunately we had the worst complication, which is that that flap of tissue that was so important to his recovery really did not survive. And so that's why things started to break down, things got infected, and that's why we said, you know, we really kind of have to do this all over again, which is devastating not only for Clark and Anita, but also for the surgeon,
team,
because
right.
you spend many, many hours putting this together. You've invested that time and you have that relationship. It's really disappointing for them, and they put all their trust in you, and then when things don't go well, it's really very personally devastating to any of us microsurgeons.
Right, but I think that's a very important point, because surgical site infection is something that we're all very aware of for any kind of surgery, and it is actually counted. It's one of these outcome measures that hospitals are very concerned about. But I think it's really important the way you describe this. It wasn't really around surgical technique, meaning what the physicians didn't scrub hard enough or there were germs floating around in the air. But you're saying that in this case, you felt that the determination was really the blood flow.
Correct.
That it was really the veins and arteries in the small area of skin that just didn't function as well as they might have.
Right. Either the vein clots or the artery clots, or they both clot. And if that happens, that piece of tissue does not survive. Now, then you have to regroup, discuss your options, and in his case, he does have two thighs, so we said, you know, your best tissue still is your thigh, but we have to take it from the opposite side. So now you'll have a matching racing stripe, and you'll have two scars. And fortunately, that tissue did work.
That must have been tough to hear that news,
It
that it
was.
didn't work.
It really was.
Do you remember how you felt?
Oh, yes. I mean, I was devastated that I had to go through, not the initial whole surgery, but I knew what I was in for. And the thought in the back of my mind was, what if this one doesn't work as well? What happens
Right,
then?
so you see that there's continued risk. It
Right.
may not work.
Right. And will there be an end to this?
But I think the point, I mean, this is like a sort of a technical point, but it was a new flap of skin. There were new veins and arteries
Yes.
to work with. So what would be the chance of it ever happening a second time? I guess everything's in the realm of possibility.
Right. So we generally quote there's a less than 5% chance. So once again, we say the same thing all over again. Yes, there's a less than 5% chance, knowing full well that 5% was 100% for your first flap.
Right.
So yeah, you are extra cautious and you lose more sleep the second time around because you are very, very concerned that your patient not go through the exact same complication again.
Correct. Right. So this time it worked.
Yes, fortunately it did. Now, he needed radiation, which is very common with head and neck cancers. And the problem with radiation, as we like to say, it's the gift that keeps on giving, meaning that apparently was the ad slogan for phonographs back in the 1924s, but we use it in a more negative sense in that, yes, radiation kills cancer, but it also damages normal tissue, and it hurts the blood circulation to normal tissue. And in this case, it hurts the circulation to that bone. And so if you have a dead piece of jawbone, that is very weak and it fractures, and that's what happened here.
I see. So it was a complication of the second step of treatment, which again, I think, has its risks as well as its rewards. And unfortunately for you, you got the second blow of having another complication.
Yes.
Now, most patients who have a mouth cancer and undergo a big operation get one microsurgical flap, and that's it. And now we're talking to him about yet a third flap. We've already taken both thighs. Now we're saying, well, now this time we actually have to take not just skin and fat, but now we have to take one of your leg bones with a piece of skin attached to it and bring that up to your face. Use the bone to reconstruct your missing jawbone segment, and use that island of skin attached to that bone to resurface the outside of your face.
Right.
Which means you're going to have a sort of a patchwork reconstruction, and where you're going to have an island of skin here, which does not necessarily match the color of your face because it's on a different part of your body, does not necessarily match the hair density because it's leg hair that grows out of that patch of skin, not your beard hair that grows from the rest of your face. And with radiation tends to actually kill the hair follicles, so you may not even grow a beard on that patch of skin. Interestingly, the patch of skin from his thigh that's in his mouth still thinks it's thigh skin, so it will grow whatever hair grows on your thigh until you get radiation, which actually suppresses hair growth.
Now, as much as it was devastating for you and very painful to have to go through, now this third surgery, I'm also struck with the balance in that equation with just how much, again, artistry and planning this took on the part of the team that they could even come up with these solutions. It's pretty amazing.
It really was. I mean, I remember being in your office and you describing each step, and it truly was amazing what they did. And then that skin that they brought up from my leg did not work out. And you want to tell them about what?
Sure. So once again, radiation is always a challenge. The rest of his cheek had received radiation to cure the cancer, but that meant that it had trouble healing to that island of skin that we brought up from his leg. And we tried to wait it out, but then we started to see holes in the skin, and we could start to see the hardware that was keeping his jaw together. And in that situation, we thought, well, now we're going to talk about a fourth free flap, or fourth microsurgical flap, which we have to take from somewhere else on your body, because all the tissue in the area of your neck has received radiation and is not healthy, and we have nothing that we can just simply stretch up to the site. So now we have to look for yet another site on his body to borrow tissue with his blood vessels, bring that up to his face, and reconnect them to some other blood vessels in his face. So here's someone who normally would have got one flap, now is looking at his fourth flap. And he had lost so much weight by this time, but I said, you have a lot of loose skin on the side of your chest. we could take that piece of tissue along with a small piece of muscle so that we could lay the muscle along the plate that got exposed, and we can use that big piece of tissue to fill in your cheek and really replace that unhealthy island of skin from your leg, which is what we did.
So you must have started really feeling like Bionic Man by that time.
Well, let me tell you, I couldn't believe this was actually happening.
I guess not.
I mean, I guess sometimes that happens. But I'm very positive. I was very positive. At that point, I guess we were almost 3 years in, and I had no return of cancer.
Right, which was, I think that's really an important point. I mean, as much pain and suffering that went into this, you never lost sight of the goal, and the goal was to be cancer-free. I mean, I think that Clark was in for the long haul, longer than he had ever anticipated, but he never lost sight of the goal, and neither did Dr. Lowe and his team. I mean, they kept coming back. Painful as it was, I'm hearing, it was as painful for you from a professional problem solver, you know, kind of perspective, as it was for you physically and emotionally to be going through as the recipient of all this. But it sounds like he was one of these stump the star cases.
Yes. In your lifetime, you have a number of cases where you have your either favorite patient or your most memorable patient or your biggest problem patients. And he was certainly in that category of some of my most challenging patients that I've ever had to help treat. And it didn't end there. That flap was successful, but because of the radiation, we again saw some wound breakdown. And then when I went to clean that up in the operating room in yet another operation, we saw that the entire metal plate was infected, and that entire piece of hardware had to come out. So we had to heal yet another challenging wound.
And how did that work?
And that brings us almost to the current time where we thought, okay, now that the plate's out, everything should heal up, and it looked like it was going to, until I got an email message from Anita in the middle of the night saying his neck is blowing up and it looks all infected and we don't know what to do.
That's one day you wish you hadn't read your emails.
Yes.
So then what?
So that, it turned out, was a small tunnel that led from the floor of his mouth into his neck and had created a what we call an abscess, or a pocket of pus, which required drainage initially to release the pus, which then meant that he had a tunnel connecting the floor of his mouth to his neck, what people call a fistula. So we took him back to the operating room for yet another debridement. I tried to close that off, and it drained for a long time, but then one day he came back to the office and he said, you know, I think it's closed up.
Well, you know, isn't that a way, though, the body does try to heal itself by really draining out the infection?
Yes, infection does need to drain, and then the tissues settle down, and then you hope that, in fact, it'll seal off any leaks that are there.
Right. So this time it was a win.
Yes. However, Clark and I continued to discuss, are we really done yet, or does the artistry part start to come in now, where the flap is not entirely symmetric. He's a little fuller on the right side of his face where the flap is, and there are times when he says, you know, do you think you could trim this a little bit more? And then we have a discussion about, you know, we've had so many stumbling blocks and so many complications. Do we really want to mess with success? Is it important enough? And then we get into the fact that, yes, appearance actually is very important to everyone, the way they interact with society. And if this still makes him self-conscious, if it still interferes with how he interacts with people he knows or new people, then it's something that is really worth discussing and considering.
Well, Clark, now you have to tell us about that, because just as a listener to this discussion, having gone through 4 surgeries when for the average person, whoever that may be, was only 1, and you've gotten through it, you have a remarkable staying power, ability to, you know, just to really, you know, stay the course. And you have said, you know, your attitude has been a lifesaver for you.
Right.
And you know, you were a handsome devil before this all started, and now with your sparkling eyes, you're still handsome. Look at you. You're adorable. So I mean, after coming through all this, you are now wanting to be like in GQ. You know, you really are now back to thinking about you want to be handsome, like we saw in those pictures earlier.
Well,
tell us about that. I think we want to hear about that.
First of all, I really did not have any major pain through most of the latter years. But I did take some pain medication, but it wasn't excruciating. And then the pain eventually went away and I was fine. So after, I forget how many, to reduce this big bunch of tissue, we got it down to where I am now, and you know, I hope that this is the end of it. And we were talking earlier that I don't know if I want to risk any more infections by maybe getting a little bit more.
Right. So this is really important, and I think again for our viewers, the doctor-patient relationship is so pivotal. You've gotten to know David Lowe very well. He's one of your best friends at this point. So you have a lot of confidence in him. You know he has a lot of technical ability. He's very compassionate. He's been very responsive to your needs. Is it putting him in a difficult position to ask him to do any more surgery on you and take any more risk? Have you given that any thought?
Yes. But knowing Dr. Lowe and his skills, I don't think if I wanted it done, I would have all the confidence in Dr. Lowe to do it. All right? I'm not worried about that. Excuse me. I'm thinking there is a risk that I would have an infection, and under the circumstance, with radiation, I don't know if it's really worth it at this point. Maybe a year from now, I might feel differently. But I have all the confidence in Dr. Lowe. I'm sure Dr. Lowe would say to me, Clark, it would be too risky if you wanted to change it.
Right.
And I would trust him on that.
Right, so you're still having that conversation is what I'm hearing. It's not a yes and it's not a no. You're still looking and weighing all the variables, which again is a process. These things aren't simple. They're not black and white, and they have to really be thought through very carefully, and that's why having a trusted relationship is so critical to the whole process and to the healing process. But what's your opinion in terms of you being a plastic surgeon really on the reconstruction side, you know, getting the function back? He has the function. What's your opinion? Like, where's that fine line between reconstruction, function, and beauty?
Well, our definition of reconstructive is to try to make someone look normal again. And if you need to be honest, you would say Clark does not look entirely normal. He does have scars. He does have some soft tissue asymmetry. And his wife is a portrait painter, and so yes, appearance is something that becomes a very important part of their lives. And so if I were to revise this flap to try to make it somewhat more symmetric, I would still consider that to be a reconstructive stage of his recovery. I would not say, oh, well, now you just simply want to look better than you look. It's not cosmetic in that sense. If he looked completely normal, he said, well, but now I want my neck tightened and kind of do this a little bit. And I'd say, no, now we're getting into the cosmetic world, and I think those risks are really not worth engaging.
Very good. Well, I think that what we've learned is that it has been a journey. And what I think is really to be admired is that surgery does have risks. We never want to think that we're going to be that person. But I give Clark a lot of credit for sharing with us that he was one of those people in the 5% or less. And also for David Lowe to say, you know, as a surgeon, you can put all of your best effort into a particular case, and you have all the expertise in the world. Every precaution was taken, but you still will have a long-term challenge. And Clark and Anita have been at this whole process for over 5 years, and they've come through a great deal. But you can see from our discussion today that their success is really that match between great medical health care. They had wonderful nurses at the hospital of the University of Pennsylvania and other healthcare providers. They had each other as a terrific couple. And that relationship between everyone, that term, it takes a village. I think that David Lowe and Clark Natale and his wife Anita, they are examples of the front of that village. There are many other people behind them. And I want to thank you both again for sharing your story. It sounds like the story will go on, but however it does go on, I think you're going to be very successful. Good luck.
Thank you.
Thanks again
Thank
for
you,
being
Nancy.
with us. And thank you for being with us today, too. Have a wonderful day. I hope you enjoyed our conversation today and that the information will help you in meeting your health goals. Catch this program and other conversations on the website, drnancyrn.com. Or you can write to me as well. I welcome your comments and feedback. Thank you for listening, and join us again. And remember, with health, all things are possible.